everyone, I'm Dr. Debbie, a consultant psychiatrist and psychologist. I make videos on mental health education and self-help improvement. The goal is to help demystify mental illness and provide you with tools that will help you be your best and live your best. On today's video, I'll be talking about panic disorders and panic attacks. This is the first of a three-part video. Today, I will be focusing on how to recognize a panic disorder. A panic disorder is described as a sudden, intense fear or discomfort that is accompanied with physical and cognitive symptoms. There's a variant of the panic disorder which is called the Nocturnal Panic disorder. This is a situation that occurs when someone is sleeping. So the individual wakes up suddenly into a panic attack. It's different from the person waking up from a nightmare and then going on to having a panic attack. This occurs with the person literally waking out of sleep into a panic attack, and it often occurs 1 to 3 hours into the sleep. There are 4 things that characterizes a panic attack. Number 1, the anxiety builds up quite quickly. Number 2, the symptoms are quite severe. Number 3, the individual is afraid of a catastrophic outcome. And then number 4, there are changes in the behavior of the individual following the panic attack. Now, having talked about these 4 things that characterizes a panic disorder or a panic attack, there are also 4 components of a panic disorder. 4 components, kind of different from the 4 things that characterizes a panic attack. These 4 components include, number 1, the physical symptoms that the individual experiences. Remember, I said that there are symptoms that occur. Now, these physical symptoms is one of the components of a panic attack. Number 2, the thoughts that go through the mind of that individual. In other words, they are called distorted thoughts. They think in a particular way when the panic attack occurs. Number 3 thing that happens is the emotion of fear or intense anxiety that occurs. And then number 4 is behavior that occurs following the panic attack. There are physical symptoms that could occur during the panic attack. These physical symptoms can include choking sensation. In other words, a sense of being choked or finding it difficult to breathe. There could be chest pain or a discomfort in the chest area. There could be palpitations. Palpitations is when you feel your heart beating. You are not supposed to feel your heart beating, but during a panic attack, you feel your heart beating and you feel it racing really and pretty fast. There could be sweating occurring during a panic attack. The individual could feel dizzy. The individual could feel some sense of being unsteady. In other words, walking and feeling as if it's going to fall, and feeling as if the individual may feel as if he or she is going to faint. There could be nausea, the sense of feeling like I'm going to throw up, or some form of abdominal discomfort. So you may find yourself going to the toilet frequently, or just being uncomfortable, feeling bloated, or just feeling uncomfortable generally in the abdominal region. There could be a sense of depersonalization or derealization. That just simply means the individual feels as if he or she is not real. So you may hear the person saying something like, "Can you hear me? Am I making sense?" That there may be a sense of feeling as if the environment is not real, a loss of time. So the individual may feel like, time is passing and I'm not part of what is going on in the environment. There may be a sense of numbness or a feeling of numbness. This could occur in any part of the body. It could occur in the hands, could occur in the legs. There could also be a tingling sensation occurring in the legs or in the hands. There could be a feeling of hotness or chills also occurring in this individual. And there could also be a feeling of trembling, literally shaking. Now, I have listed about 11 symptoms. The presence of at least 4, including the remaining 2, there are other 2 things to look out for, which is an intense fear of either one feeling as though they are going to die, or the fear of one losing their mind or losing control, making 13 symptoms. Once there are 4 out of these 13 symptoms, it is said to be diagnostic of panic disorder or a panic attack. There is, however, conditions where an individual may experience these symptoms but may not have up to four symptoms. Now, when this occurs, it is said to be limited symptom panic disorder, or is called non-clinical panic attacks or non-clinical panic disorder. There are three kinds of distorted thinking that can occur during a panic attack. 1, catastrophizing, 2, fortune telling, and 3, jumping into conclusions. These three are kind of similar, where the individual blows things out of proportion in their mind and assumes a very terrible outcome without considering other variables. So the individual can think, because I'm having a fast beat heart rate, then perhaps I am having a heart attack. The individual can think that because I feel dizzy, then I'm likely going to pass out and faint or embarrass myself. You know, the individual can also feel like because I'm experiencing some sense of numbness, that perhaps I'm having a stroke. Now, when this occurs the first time, it's justifiable to think that way. But then when it keeps happening again and again, and you don't have a stroke, you don't have a heart attack, you don't literally faint, but you keep having that kind of thought, then it just supports this kind of three distorted thinking that the individual may be experiencing. Having said that, there are also three kind of behaviors that are associated with a panic attack. Now, the three behaviors are: number one, there are things we call the safety behavior, where the individual does certain things just to feel safe. So you can see an individual carrying a bottle of water, for example, feeling like, oh, I have to just hold water so that I don't get dehydrated and lose consciousness. Or the individual may feel like, oh, I need to just put a lot of food around so that I can eat a lot and just address the weakness so I don't faint. Or feel like I need somebody to be present with me so I can feel safe. Or I just need to be able to reach out to the doctor and call the doctor so I feel safe. Number two kind of behavior that's associated with panic attacks is something called avoidant behavior. Now, the avoidant behavior is where the individual just generally avoids things that in his or her mind has been associated with possible panic attacks. So he may avoid going to certain places, avoid doing certain things, avoid taking certain kind of meals, or just generally avoid in a sense, and that way feel safe not to experience a panic attack. The third kind of behavior associated with a panic attack is escape behavior. So there is avoidance behavior, there is safety behavior, and then there's escape behavior. With escape behavior, the individual just wants to be in a position where, just in case something happens, he or she will be able to escape the environment and feel safe. Now, these three behaviors associated with a panic attack or a panic disorder, immediately it kind of gives a sense of safety. It kind of gives a sense of I am coping with my stress and my challenge. But in the long term, it has a negative effect because it doesn't help that individual to fully be able to manage the situation as the time goes. So this brings me to the end of the first of the three-part video on panic attacks and panic disorders. In subsequent videos, I will be talking about why it happens and how best to manage it. Just in case you've not subscribed to this channel, please do, so that way you don't miss out on the subsequent videos.